come into the room. Hi, my name is Anna Newsel. I'm your nurse for today. Can you tell me your name and your date of birth? How are you doing today? Checking the wristband. There's no wristband on here, but maybe it's on the other side. Nope, nothing. So obviously you would go get them a wristband. So your name is Jessie. Hi, Jessie. What brought you into the hospital today? Can you tell me the date? Can you tell me where you are? Can you tell me what month it is, who the president is? Some questions for orientation, okay? Now I've drawn a blank. Oh, let's see. Okay, so I'm gonna take some vital signs, but you're not gonna do the vital signs for the head to toe checkoff, because you've already validated that. You can do it, okay, and it's only 20 minutes. But I'm going to do a little bit of an assessment on you. Is that okay with you? Okay, I'm gonna wash my hands, put my gloves on, and move his hair back a little bit. Actually, I'm just gonna check and see if you have any issues with your hair. Does anything hurt when I press down on your skull? No? Okay. Will you do me a favor? Can you turn your head to the right? Can you turn your head or to the left? Can you turn your head to the right? Can you move your head up, down, make a circle? Can you shrug your shoulders up against my hands? Good. All right, now I'm going to get my pen light. Thank you. I'll give it back. I'm gonna just shine this light into your eye. So, shine the light into this eye, and I'm gonna look to see if this pupil constricts. Shine the light back in this eye and look to see if this pupil constricts. I'm also looking to see if they're round. All right. And then I'm gonna go over to the other side. Oh, I know that light's bright. You're being so good. Thank you so much. Okay, now I'm just gonna look in your nose. Have you ever had any surgeries? Can you breathe pretty well through your nose, or do you just breathe, are you a mouth breather? No, everything's okay? Good. I'm gonna shine my light into your mouth. Look to see, all you're looking to see is if, do they have any lesions? If they have dental caries, missing teeth, those kinds of things. Ask them if they wear dentures. Do you wear dentures? Wow, you don't. That's wonderful. Can you stick your tongue out? Some people can stick their tongue out. Some people can't. Some people have it tied. Actually, it's a genetic thing. But just check to see if they're able to stick their tongue out. If they can stick their tongue out, some people can move it from side to side. That's also checking for a cranial nerve. I'm just gonna look in your ears. Do you ever have any discharge in your ears? No. Do you wear hearing aids? Looking to see if there's any kind of drainage, redness, bulging. Don't wear hearing aids. Okay, I'm gonna whisper 3 words and I want you to repeat them back to me. See if they can say 1, 2, 3. And then you go over to the other side of the bed. Red, yellow, green. See if they could say red, yellow, green. And you whisper them. And you're behind them so they can't lip read. Okay? All right. So I'm going to ask you a few other questions. Can you lift your eyebrows? Can you puff out your cheeks? Can you frown? Can you smile? That's wonderful. That's good. Those are checking other cranial nerves. So those are questions you should be asking for those other cranial nerves. Remember that little sheet of paper I gave you? All right.
You're welcome.
All right, now I'm gonna move down and just look at your chest and listen to your lungs and your heart. Are you okay with that?
Professor?
Yes. Oh wait, I'm sorry. Yeah, no, don't tell me yet. Before I do that, I'm just gonna check your carotid pulse. So have the client turn towards the hand that the side that you're pressing your hand into, and you should be able to feel the pulse. And then do the same thing on the other side, have them turn their head the other way. Then listen. And it should sound like a heartbeat. Alright, is that what you were gonna tell me, or is there something else?
You forgot to ask if they're wearing glasses or contacts.
Okay, do you wear glasses or contacts? And if they do, then make sure they're using their glasses and their contacts. Alright, or if they're at home, encourage them if they can't see to bring their have someone bring their glasses in so they can use them when they're in the hospital. Alright, then you pull down so the chest is exposed, and I guess I'll listen to lung sounds first. So always inspect first. So I'm inspecting to see if the chest is rising symmetrically on both sides. If the client has a fairly decent respiratory effort, if they have any accessory muscles that are being used, that's abnormal, right? So you look to see if they're having easy inspirations and expirations.
And we're gonna be doing this on each other, right, Professor?
I think that's what the faculty decided, yeah. You take a deep breath in through your nose and out through your mouth.
Right? Because she had just said that it never bigger than.
Not too fast, don't make them hyperventilate, just tell them to take slow, deep breaths. And I usually do at least to the below the nipple line on the front of the body. And then I listen on the right, underneath the axilla, a little bit lower, and then a little bit further back, because there's 3 lobes there, right? On the right side. And then I go over to the left. And we're not gonna do this on the mannequin. Can you stand up, Jaylene? But if you're gonna listen in the back, I tell the client to hug themselves. And then you just listen to the areas in the back. And I'll just put this on you. Yeah, and you stay away from the scapula. So you go above the scapula. Here, let's have you stand like this. You're being so good. Above the scapula. And then along the spinal area. Because the scapula is bone. You won't hear anything there. And then down a little lower in the back. And you'll be amazed if you've listened and practiced on people, you can really hear the vesicular sounds. Thank you. We're not gonna do it on the mannequin because it's too hard to turn the mannequins and they're all plugged in. All right, so after I've listened to the respiratory sounds, then I'll do the cardiac sounds. So I feel for the second intercostal space. Listen to the aorta, the pulmonic, Erb's point, tricuspid, and then at the midclavicular line at the 5th intercostal space, the mitral valve, point of maximum impulse. This is where you take your apical. Okay? Anyone have any questions about any of this so far? No? All right. And I did not say this, but when you're inspecting to make sure that the only place you're seeing any kind of uplifting is at the point of maximum impulse. Sometimes you see that in, younger people or people that are real thin. But you shouldn't be seeing any abnormal vibrations or movements of the chest area. That's just not normal. Okay? All right. I like to go down to the limbs next. So I'm gonna be looking at my skin all the time. So this has got a lot of things on it, but I would be checking both sides for temperature, looking to see if they have any scars, bruising, lesions, any open areas, and be documenting that appropriately. As far as the skin goes, I could have done it, I forgot, but can always go back. I would check for skin trigger up here. Alright? When I did the chest area, I'm looking at the skin there. So you're kinda always looking at the skin with every body surface, yes.
Does it matter what order we assess things in?
No, but you just have to do all of it. So whatever is good for you. And then for the hands, I'll check for capillary refill. I can check for clubbing. This mannequin's not real mobile, but you can do range of motion on any part of your body as you're doing the assessment. So with this mannequin, can they put their arm in? Can they draw their arm out? Can they lift their arm up? Can they, I can't flex his, but can you flex your arms at the fingers? Can you spread your fingers? Can you put them back in? Can you lift your hand up? Can you lift your hand down? So there's a lot of things we can do. Can you do circles with your wrists? That's all range of motion stuff. So I just kind of like to do it as I'm moving along through the whole physical assessment.